Hello, welcome to my channel. My name is Nurse Pauline RN. The goal of my channel is to assist nursing students to be successful in their fundamentals of nursing exam. My topic today is on physical assessment. The goal of our physical assessment is to assess the patient from head to toe. Today I'll be doing my assessments in the form of an alphabetical order in order for you to follow me. First thing in an assessment, we'll assess the general appearance of the patient. We'll start for A and we'll do our inguinal hernia assessment, which is a bulging in the groin area. For abdominal assessments, in order, inspection, auscultation, percussion, and palpation. We're auscultating for bowel sounds, and this is in the left upper quadrant, then in the right upper quadrant, then in the left lower quadrant, and then the left lower quadrant. I hope I did not get that mixed up, so I'm going to repeat it. We're auscultating the abdomen starting from the left upper quadrant, then to the right upper quadrant, then to the right lower quadrant, then to the left lower quadrant. Each quadrant, when we're listening for bowel sounds, we will take 1 full minute for listening to the patient's bowel sounds, especially those patients coming back from surgery. Murphy's sign, when it's positive, this is a sign for appendicitis. Patients will wear an anti-embolism stocking, which promotes venous circulation, prevents thrombophlebitis. For the ear, before performing an ear examination, before inserting your speculum, check in the auditory canal for presence of foreign bodies. Tinnitus of the ear means ringing of the ear. For ear, in conductive hearing loss, there's physical obstruction to the transmission of sound waves. For the eyes, we'll use the Snelling chart for eye examination. Myopia is for nearsightedness. When we assess the patient's eyes, it's called PEARRLA. Pupil, E equal R round, RL reactive to light, A reactive to accommodation. The left eye is OS and the right eye is OD. In the eyes, we do testing for extraocular movement in the client to assess muscle weakness. This testing is called the 6 cardinal position of gaze. And this examination, I'll take a look at the pen with my head not moving, and I'll put the pen to this side and I'll just look at it. Then the pen comes in front, then it moves to the right side, and I'll just gaze to the left side. This test is called 6 cardinal position of gaze, assessing for muscle weakness. For the pulses, that's the heart, we have +1, that's a grading of pulse, that's weak and barely palpable. 2+ grading of pulse is normal, easily palpable. 3+ of pulse is full pulse. 4+ pulse is strong and bounding. For your heart murmur is an abdominal heart sound, a faint blowing or whooshing sound with high, medium, or low pitch. Your capillary refills for your heart, it should be assessed with 2 fingers. Your capillary fills should be less than 3 seconds. When we are assessing for jugular vein extensions, it should be less than 4 centimeters. Cyanosis is bluish mottled color of the skin, seen in fingers and toes. For musculoskeletal system, we have kyphosis, which is an exaggeration of the posterior curvature of the thoracic spine. Scoliosis is lateral spinal curvature. For your neurologic assessment for your stroke patients, this patient will experience facial drooping and slurred speech. Please call the med team. For neurological assessment, Babinski sign, you see this for the newborns. It is a dorsiflexion of the great toe and fanning of the other toes after firmly stroking the side of the foot. Assessment for meningitis is a positive Babinski sign. The patient will sit in a supine position, gently flex the head towards the chest. The patient should feel no pain, no resistance to neck flexion, no pain in the vertebrae. Patients with hemiplegia are examples of our stroke patients. We provide for them a safe environment. These patients are at risk for falls. In respiration, we have the Cheyne strokes, Cheyne strokes kind of respiration. And this is a rhythmic respiration with periods of apnea. The word is apnea. For pulmonary ventilation, movement of air into and out of the lungs. This is quiet breathing, not deep breathing. COPD patients for respiratory, they are breathing with pursed lips. They are retaining less they are retaining less oxygen, and they're blowing like the candle. They are blowing out excessive CO2. They are doing pursed lips. They are blowing as if they are blowing a candle. And this is a test question. These patients are given a brown paper bag sealing their lips around their lips, and they will blow into this brown paper bag to control breathing. And this is a test question. When patients have asthma, dyspnea, wheezing, difficult breathing, ineffective airway, we will call the med team. Patients with jaundice of the skin, their skin is yellow in the sclera, nail beds, mucous membrane. Cyanosis is blueness of the skin. Remember, the skin is a portal entry for diseases. Pitting pitting edema of the skin, we have 1+ edema, which is barely pitting. 2+ is deeper pitting, rebounds in seconds. 3+ pitting is deep pitting, rebounds in 10 to 20 seconds. 4+ pitting edema is a deep pitting, rebounds greater than 30 seconds. Testicular examination of our male patients. We are teaching them to do monthly testicular examinations, the same time every day of each month. After shower or bath, their hands will be warm and soapy and their testicles are warm. Okay, this ends our physical assessments. Remember, patients who have ineffective airway clearance, symptomatic with their vital signs, chest pains, stroke, we will call the meds team. Thank you. No pulse, no respiration. We'll call code blue. Have a good day. Hope you enjoy this series. Hit your like button, hit your thumbs up, share my video. Have a blessed day. Thank you. Keep on studying hard. Thank you.